Welcome back. The Matters Network provides wraparound services for addiction treatment with their electronic referral system. And here with more details on how this works and why it's important is Mila. Welcome. Thank you so much for joining me.
Thank you for having me here.
Of course. Let's talk about Matters and what you do there.
I am the operations manager at Matters, and Matters is a nonprofit organization that was created in 2016 with a focus on improving and creating better pathways for care and resources for individuals with opioid use disorder. And the reason we created the program was because originally individuals with opioid use disorder were given a list of treatment organizations and asked to call them. And the problem with that is that treatment wouldn't be available until like 6 or 8 weeks out. So we created a rapid referral process that allows them to get connected in as little as 24 hours. And we've also added additional wraparound services, recognizing that there's barriers to treatment. So medication voucher for up to 14 days, transportation voucher, support services, peer services, basically anything that we see that might be an issue to linking to treatment, we offer it.
Or a hurdle. I love that. Okay. So how does it work and how have you been able to grow since you started?
So we started in 2016 locally in Buffalo. We are now live in all of New York State. We're also in Allegheny County in Pennsylvania, so expanding. I think people recognize the need. And we started in an emergency department, and now we kind of partner with anyone who is willing or comes face to face with an individual with opioid use disorder.
Amazing. Okay, let's talk about the types of organizations that can link up with Matters.
We really don't turn anyone away. As I mentioned, it started in the emergency department, and now we have supportive housing partners, jails, EMS, libraries. Really anyone that comes face to face with an individual with opioid use disorder can use the referral platform. It's meant to be super simple and easy, efficient. It removes the hurdle of like extra work, having to call and schedule a treatment. It's done in 3 minutes, super quick and efficient.
Okay, so, we know that the opioid use has risen over the past 5+ years, unfortunately. So there's a need there. How successful has this been since you've started, and obviously now you've continued to grow?
So actually, I recently just checked our data, and we've had about 5,500 referrals through the system. So it's definitely successful. People are actually staying in treatment longer. We see higher retention rates. Also, getting people into treatment is really important, right? Being able to be seen within 24 to 48 hours is important. So being able to get them their medication, not having to worry about paying for that medication, all of that has been really helpful. So it's really grown.
I love that we're talking about the barriers that people face, right? When we're facing something like addiction, especially for opioid use. Telling someone, okay, I'll see you in a month when they're ready for help now, that's not helpful. Or telling someone, okay, come to me, but you're 30 minutes, an hour away and they don't have a car.
Right.
That's not going to be helpful. You guys have seemed to have thought out and seen all of the issues and found a way to rework them.
Yeah, so we implemented a support services program for that purpose. Is we want to continue assessing what potential barriers there are. We want to make sure that we address everything. We want this linkage to be successful. So the support services program, for instance, they reach out to patients at 24 hours and then 30, 60, 90 days. Just making sure, like, did you get connected? What can we do to help you get connected? We're just constantly looking at any hurdles and trying to overcome them.
And seeing it through, which is important.
Yes.
If an individual watching right now might need support, how can they get in touch with Matters?
There are a few ways. You can visit our website, mattersnetwork.org. You can download our app. You can get referred that way. You can get connected through telemedicine that way. Our app is also called Matters Network. But yeah, as I mentioned, they can get connected to telemedicine, which is available 24 hours in Western New York and 12 hours through the rest of the state. And then they can call us at 765-MATTERS or 765-628-8377.
Alrighty. Well, obviously, you started off by saying that you're a nonprofit, which you need help to continue to do the work that you're doing. How can our viewers support you?
Honestly, partnering with us is the best way, just making sure that you spread awareness. We provide lots of educational material. We do a lot of leave behind cards. We offer harm reduction resources. So really just spreading awareness, getting to know the website, and letting us know. We listen to the community's feedback and try to grow. We want to know what is needed.
Yeah. Amazing. Amazing work you're doing in our community. I'm glad that you came in. And it's important to talk about these things for our viewers. We never know who's watching right now struggling and that can really use the support that you have to offer.
Thank you so much. Thank you for having me here.
Thank you. Viewers, if you'd like to learn more about Matters and all of the services they provide, just visit mattersnetwork.org or call the number right there on your screen. Thanks again for coming in, Mila.
Thank you so much.